My name is Bruce Hanna. I'm a state representative from House District 7, which is down in Roseburg. I represent rural parts of Lane and Douglas County. I appreciate the opportunity to testify this morning and for your patience and willingness to move around a little bit to keep schedules working. I'm proud to bring to you this morning House Bill 2504 and your consideration of this bill. We all know it's no secret that health care costs are rising, continue to rise, and that rise is dramatic. The average individual or family health insurance plan in Oregon and around the country range from $140 a month to $1,300 per month. Currently, there are 193,000 Oregonians who purchase their own individual or family insurance plan. When you include the 21,000 individuals who have lost group health and choose to buy a portability plan, and nearly 16,000 additional individuals in the government's high-risk pool, you have more than 230,000 individuals who do not receive coverage through their employer or a government program. Again, at a cost between $140 a month for a young, healthy individual to a cost of $1,300 a month or more for a family, the cost of self-coverage for health insurance can be onerous. Individuals and families are simply faced with a very difficult choice: pay or have no coverage for care. Further, as you know, through discussions with the federal government, we have seen an individual mandate made on all Americans, and adding to the mandate for that care is an individual or a punitive tax if you are not covered. Beginning in January of 2014, that tax will be $190 for two adults. It grows to $650 for two adults in 2015, and by 2016, that cost or tax will be $1,390 for two adults. I believe we should be doing all we can to incentivize health insurance coverage for Oregonians. We're all aware of the savings to health and to the system when people have health insurance and get health care. But if our only approach is to say either fork over thousands of dollars per year or take your chances on health care and pay a penalty, I don't believe we're establishing good policy. This bill is simple. It encourages individuals and families to purchase health insurance and deduct the cost of that insurance from their taxable income. I believe if the government is going to mandate coverage, then we have a responsibility to help Oregonians meet that requirement. Legislatures around the country, including ours, love to talk about or balk at unfunded mandates, those laws that require us at the state level to do something or provide something, but don't help us with the resources to do so. It's a good argument. But here we can do something to help. And at no point has this been more necessary than in a time when our state unemployment still lingers at the 10% mark or higher. And I can tell you, as a business owner and provider of health care to my employees, it is becoming more and more difficult and more costly to provide that care. I would encourage your committee to take a close look at House Bill 2504 and encourage you to join me in supporting a common sense solution for Oregonians that this bill may provide. Thank you, co-chairs.